Welcome to the third in a series of 4 screencasts on the prevention of food waste in the healthcare sector. I'm Jessica Twemlow, a technical advisor working on behalf of RAP in support of the Hospitality and Food Service Agreement. So far in this series, we've looked at why wasting food matters, the size of the issue, and the value of food that is wasted, why waste prevention is key to making cost savings, how you can help by promoting food waste prevention and signposting sources of support, where food waste arises, and how food waste can be measured and tracked. In this screencast, I'll be talking to you about how hospitals can make changes to prevent and reduce food waste in a ward setting. It is important to recognise that some food waste is inevitable within the hospital environment. Levels of food waste can be considered acceptable when any attempt to reduce them would compromise quality, patient choice, or the nutritional intake for patients. However, with careful planning and consideration for patient needs, there is scope to reduce food waste, regardless of the type of food waste service, and in many instances before the food even reaches the patient. In this third screencast, we'll look at opportunities to reduce food waste in the ward, including preventing spoilage, monitoring the meal ordering system, improving staff communication, preventing plate waste, and protected meal times. This screencast will last about 15 minutes. But how can you prevent food waste in the ward setting? The first step is to prevent spoilage. Over-provision of perishable stock for patient snacks outside of meal times, like bread, milk and yogurts, can be a significant source of food waste in the wards. If wards order the right amount of the right types of food, then they will be less likely to waste it, which will save them money. Here are some tips. Provide general stock on a daily basis, so staff only need to order enough for one day. Remind staff to rotate stock to ensure the oldest food is used first. Monitor and track the stock provision to different wards in the hospital. This will allow you to compare wards with similar bed numbers to highlight those wards that are over-ordering. And ensure that wards store foodstuffs at the right temperatures and check fridge temperatures regularly to make sure they're correct. You could tackle bread waste by supplying wards with split loaves of brown and white sliced bread. Often full loaves are provided to wards, and these may be returned to the kitchen with only a few slices used from each. However, for food safety reasons, sometimes the entire remaining loaves will have to be disposed of. Every hospital knows in theory how their patient meal ordering system should work, but it's important to check how it actually works at ward level. Important aspects to investigate include: are the numbers of portions and meals ordered by each ward translated into the quantity of food sent to each ward? Are the menu order forms actually used to generate the number of meals required? Is there enough assistance for patients, particularly elderly patients, to correctly complete the menu order forms? Do ward staff check that the menu order forms are properly completed before being sent to the main kitchen? If there are options for portion size on the menu order forms, do staff adhere to these when plating? And are the correct serving utensils used for different recipes, dishes and food items? All dishes should be accurately and meaningfully described on the menu, including principal ingredients and cooking method. Food waste caused by unserved meals is usually the result of poor communication between ward-based teams and catering teams. Responsibilities for the ordering and serving of patient meals do vary in different hospitals, but all staff providing food and nutritional care to patients have the ability to help hospitals manage and reduce food waste effectively. Although it may be time-consuming, some hospitals operate a system of confirming the number of meals required by each ward and checking against the bed state and number of menu cards immediately prior to the meal service. This helps cut down on potential waste by matching patients to food requirements. Every hospital should have clearly defined policies and procedures to ensure a safe, effective and efficient meal service. This should include procedures to transfer patient meal orders from one ward to another, order meals at short notice for new patients, and cancel patient meal orders at short notice. Systems should also be in place to ensure efforts are made to identify surplus food before additional food supplies are sought. Often surplus food may be available on adjoining wards. It is important to ensure that policy and procedures are reviewed on a regular basis to reflect any changes in working practices. A lack of ownership by ward-based teams during mealtimes may result in delays in serving food, incorrect meals, or incorrect portion sizes. This may discourage patients to eat and therefore lead to an increase in food waste. Clear ownership will result in an improved food service, and the key responsibilities should be outlined for all staff, including clinical staff, ward-based staff, support workers, and catering staff. Ward-based staff can have a positive effect on promoting hospital food and food services, which can lead to greater patient satisfaction and reduced food waste. To avoid the problem of running out of more popular orders, the ward staff can be inclined to over-order to be on the safe side. This form of bulk ordering is likely to result in food waste, as patients who are not given a menu or an opportunity to select their own meal choices may regard the food supplied less favorably and be unable or unwilling to eat. Patients should not be given menu cards if discharge is expected. The catering department should carry out regular ward visits to understand the levels for and reasons for food waste. Whilst visiting the wards, consider talking to the staff who serve patient meals and collect trays and ask them about popular and unpopular items. Consider if it's possible to remove unpopular items from the menu cycle and replace with more appealing, nutritionally equivalent foods. All staff with responsibility for serving food should be appropriately trained and be able to demonstrate compliance in the following: food service, including meal ordering, food safety, basic nutrition, communication skills, customer service, team working, and health and safety. It is important the staff are able to offer advice on menu choices, suitability of products for vegetarians, and special guidance, as well as clear guidance on portion sizes. All ward staff should review what patients normally eat, whether they require assistance to eat, and whether they have any special dietary needs. Next on the list of areas to target for prevention is plate waste. Why not consider providing a choice of large, standard, and small portions? A reduction in the portion size, with any necessarily increase in the energy and nutritional density of meals, can encourage an increased intake for patients with decreased appetites. This can ensure patients are not overwhelmed by large meal, are more likely to eat what is provided, and therefore help to reduce plate waste. Any changes in portion sizes for patient meals should always be agreed with and monitored by dietitians. It should be clear how the patients can select the required portion size on the meal ordering system, so an explanation of the portion size should be included on the menu. Where necessary, training should be provided to the food service staff on which utensils should be used for serving different recipes, dishes, and food items for each particular portion size. Meals may be of the highest quality, but the value is lost unless the patient actually consumes them. Presentation and delivery can have a big impact on food waste. It is important that an appropriate number of staff are available to serve meals promptly and without delay, to ensure quality remains unaffected and hot food does not reduce in temperature. Other key issues to consider include: are patients made ready and comfortable to eat before the meal service commences? Are beds, tables, and chairs positioned to ensure patients are able to eat comfortably? Is sufficient help available without delay for patients who require assistance or motivation to eat? And is assistance given with opening packets or removing lids? All staff, patients, and visitors should recognize the importance of mealtimes as part of the care and treatment of patients. As above all, patient satisfaction and dignity is key, and this should not be compromised in any circumstance. Hospitals could consider implementing a red tray system. A red tray provides a clear signal that the patient requires extra help at meal times because of difficulties with eating or simply because they're not eating enough. The system depends on ward-based staff and catering staff understanding and communicating with each other about what is needed when operating the red tray system. Some hospitals have a number of alternative and often innovative ways to discreetly identify patients who need help. These include red napkins, red anti-slip mats, and traffic light notices. Protected meal times are an important part of creating a ward environment that encourages patients to eat and enjoy their meals. Protected meal times are periods over a mealtime when all other non-urgent activities and treatments are stopped to allow patients to eat their meals without being interrupted by any other activity and to give ward staff the time needed to help those with assistance. Research shows that patients who are not interrupted and receive appropriate service and support during meal times are happier, more relaxed, eat more, and therefore waste less food. The protected meal time should last 1 hour. This includes 15 minutes to prepare patients and the ward for the meal service, and 45 minutes for the meal, post-meal clearance, and rest time. Compliance of the protected mealtime policy should be monitored by regular audits. Ward staff need to be confident to be able to challenge doctors, visitors, and others if they enter the ward area or interrupt patients unnecessarily during meal times. Protected meal times may only be possible in certain wards where patient movements are limited compared to short-term stay wards such as maternity or assessment wards. Condiments can be perishable like butter or non-perishable like sugar, salt, pepper, jam, and ketchup. In many hospitals, multiples of each condiment will be automatically placed on trays. For infection control reasons, any unused condiments cannot be reused and are automatically disposed of at the end of the meal service. Though each individual condiment may be inexpensive, when the number of them disposed over the entire year is determined, the number of unused condiments can be considerable and expensive. To reduce the number of unused condiments disposed of, issue condiments on request from a food trolley or the ward kitchen. Use individual containers for non-perishable accompaniments. These containers can be left on trays and restocked as required, and reduce the number of accompaniments issued with each tray. Before I bring this screencast to a close, I want to provide you with a few web links to some of the free online support and advice that you can find on our website. These online resources can help food service operators to identify quick and easy ways of cutting down on food waste costs. The Online Resource Centre offers some simple top tips to cut waste within the operations of a typical kitchen. The Hospitality and Food Service Info Finder holds a wealth of practical and proven advice with supporting guidance. Essentially, it's a search and find tool, which allows users to find the information most relevant to them. And if a food service operator is thinking about recycling food waste, we've got the Food Waste Recycling website with information, advice on tools to help them make it work. Well, that brings us to a close for Screencast 3. I'll recap on what we've covered during this session. We've looked at ways to prevent food waste by preventing spoilage in the ward, monitoring the meal ordering system, improving staff communication, reducing plate waste, and protected meal times. The next screencast in the series, Screencast 4, provides some great examples of how hospitals can make changes to prevent and reduce food waste in the hospital kitchen. And don't forget, any NHS trust or private healthcare provider can sign up to the Hospitality and Food Service Agreement. Thank you for listening. Please don't hesitate to get in touch by emailing hafs@rap.org.uk if you'd like to find out more. Goodbye for now.